Hi, I'm Katie. I'm an undergraduate student studying biochemistry at the University of Liverpool. For my third year project, I looked at the rate of uptake of rheumatoid arthritis core outcome sets. In this video, we will discuss what rheumatoid arthritis is, what is the core outcome set and what is its relevance to clinical trials, and how search portals were used to collect this data for analysis. Rheumatoid arthritis is a long-term progressive illness in which the immune system mistakenly attacks itself thinking that it's foreign. This then causes inflammation at the joints. There are a lot of severe symptoms associated with the condition, including stiffness, fatigue, pain at the joints and even swelling at the joints. There is currently no cure for rheumatoid arthritis and therefore treatments seek to combat the symptoms rather than the underlying cause of the condition. Clinical trials aim to create new drug interventions to be used to combat these symptoms. However, not all trials are meaningful. Some trialists often measure things that are easier to measure rather than worthwhile. So experts have developed this term core outcome sets, which should be a bare minimum for all trialists to measure. For rheumatoid arthritis, there are 7 core outcome sets. These are based on disease activity, patient well-being and damage of the joints. By measuring similar objectives, this will then reduce the heterogeneity between trials. This will make clinical enhancements better because we will be able to collate and compare the data between trials. The aim of this study was to assess the rate of uptake of rheumatoid arthritis core outcome sets. In this project, we used the World Health Organization search portal. However, in a previous assessment done by a reviewer in which this project is based on, they only used clinicaltrials.gov. By using the World Health Organization search portal, we hope to encompass more trials as it is a larger search portal. In the first step, eligible trials were identified by using the World Health Organization search portal. The following filters were applied to search for trials that were within the core outcome set criteria. Through further filters, we were then able to exclude those trials that were not eligible for this study. Duplications also had to be excluded by cross-checking the trial registry numbers. So, after applying the filters, there were 341 trials left to be included in the study. All these hits were exported onto an Excel spreadsheet where a further analysis could take place. From looking at the trial registry or publication, a decision was made as to whether the core outcome set was measured or planned to be measured. This was then recorded and these results would later be used for evaluation using statistical methods. The primary aim of this project was to assess the rate of uptake of rheumatoid arthritis core outcome sets using the World Health Organization search portal. I think in the future, if we can continually guide researchers to measure these core outcome sets, this will be extremely beneficial to patient care, as we will be able to build a more reliant and beneficial patient outcome profile. For further information on core outcome sets, visit the website ONMACRAT, or if you want background on how this study was carried out, then a paper by the BMJ is also really resourceful.